Bladder cancer is strongly linked to smoking history. With the rise of vaping and other substances, our team at the University of Miami, under Dr. Sanaj Poonen, wanted to understand whether those exposures carry similar risk. Prior studies have shown that e-cigarette users can have higher levels of chemicals in the urine linked to bladder cancer, as well as damage to the bladder lining. This raised concern about a possible connection. Using data from over 300,000 participants in the All of Us research program, we found that e-cigarette use initially appeared linked to a higher risk of bladder cancer. However, once we accounted for cigarette smoking, that association disappeared, suggesting the signal is largely explained by smoking history. Because many individuals use e-cigarettes to help quit smoking, we also looked at people who use both e-cigarettes and cigarettes. In that group, e-cigarette use did not increase bladder cancer risk beyond cigarette smoking alone. So the key takeaway is that cigarette smoking, not vaping, marijuana, or smokeless tobacco, remains the main modifiable risk factor for bladder cancer. We also saw that people who used e-cigarettes appeared to be diagnosed at a younger age. However, this is most likely because e-cigarette users tend to be younger overall, rather than vaping causing earlier disease. Looking ahead, these findings highlight the importance of carefully accounting for smoking history when studying newer exposures like e-cigarettes. Our study was limited by self-reported survey data and a lack of detailed information on how often or how long people use these substances. Future research should follow people over longer periods and collect more detailed data to better understand whether these substances have independent effects over time.